Welcome to the Matcha Meta Research webinar. Today we're going to hear from Neil Hadaway on open synthesis. I think of Neil as one of the foremost minds of people considering how we might best practice systematic review. So I think this is going to have a bit of something for everyone interested in evidence synthesis today. I'm looking forward to this. Over to you, Neil.
Thanks very much, Charles. That's very nice to hear. Hopefully there'll be something for everyone. Some of it might be a little bit controversial, but that's a good thing. Starting these kind of discussions. Can you see my screen okay? Yeah, nodding. Cool. Great. So yeah, as Charles said, thanks very much for inviting me, Charles and Matt. I'm going to be talking to you today about a concept that we're calling open synthesis, and in particular how this relates to maximizing the efficiency, rigor, transparency, legacy, and impact of systematic reviews and other forms of evidence synthesis. So my name is Neil Hadaway. I'm a senior research fellow at the Mercator Research Institute on Global Commons and Climate Change, and at the Stockholm Environment Institute. I'm based between those two organizations, currently based in Berlin. And I'm also a research associate at the Africa Center for Evidence at the University of Johannesburg. Excuse me. And if you're interested in following me or seeing what I'm up to, then you can find me on Twitter at Neil Hadaway. So before I get started, I just wanted to acknowledge and thank other people and organizations who are involved in this work. So the work has been conducted as part of a visiting research fellowship to the American University of Beirut back in 2019, and that was funded by Forte, the Swedish healthcare and workplace research funding organization. And I'm currently on an experienced research fellowship for 3 years, funded by the Alexander von Humboldt Foundation here in Germany. And this work is directly funded by both of those grants. The project that I'm going to be introducing at several occasions is the Open Synthesis Working Group, and that's co-led by Tamara Lotfi, who at the time when I was in Beirut was the coordinator of the Secretariat for the Global Evidence Synthesis Initiative. She's now based at McMaster University in Canada. And thanks to other collaborators who have been working in the Open Synthesis Working Group, and they're listed here. So just to give you a summary of what I'm going to talk about, I'll first start to give a brief introduction to what open science is, and I'll give an outline of what the key elements of open science are. I'll then talk about why open science is important to evidence synthesis and why open synthesis is a concept. Then I'll talk about the work of the Open Synthesis Working Group and a draft framework that we're producing for open synthesis, before going on to talk about future work of the group. And hopefully I'll leave you with the feeling that evidence synthesis is a sort of slightly open door at the moment. There's much more we can be doing to apply open science principles to evidence synthesis, but the signs are good that it will be a fairly painless process, I think. And I'll explain why as we go on. But I wanted to start off by probably preaching to the choir, talking about what open science is. Historically, science and science research has been based on patronage. So funding of scientists historically has been around prestige or ownership. So wealthy people wanted to demonstrate their wealth by paying for scientists to develop new discoveries. And that was, for example, how Michael Faraday was funded. But people started to realize that the pace of science was insufficient to keep up with the needs of society, and it wasn't flexible enough under this kind of funding framework. So several centuries ago, the patronage way of funding science was replaced by academies and public funding. And this is an example. The sketch is of a meeting of the Royal Swedish Academy of Sciences from 1877. And that's how science sort of developed and how science became a bit more open, in that historically science was based around secrecy and ownership of science. So it, by definition, wasn't very open. In fact, some people published their work in code specifically so that they could only release that code once they were sure no one was going to steal their idea. Today, we are working towards more open science, but there's still no definition of what open science is specifically. It's a fairly sort of squishy, messy concept. But broadly, open science aims to facilitate the conduct and access to science and to science research. There are a couple of definitions that I wanted to introduce, though. This one is the Was ist Open Science, which is a website you can go to. It's produced by Open Science ASAP, and this definition is from 2014. And they outline 6 key concepts that relate to making educational resources openly accessible, making research publications openly accessible, having peer review being open to the public, ensuring that our methods that we use when we conduct research are open and verifiable, ensuring that any software that we use is, the code of that software is made publicly available, and any data that's used in any analysis is made publicly available as well. So that's one concept. But since then, several other concepts have been described in the literature. This is a very complex taxonomy that's produced by Foster Open Science that includes not only aspects of the research conduct itself, but also other institutions that support science. So talking about whole, sort of the whole of science as a concept, and how openness can be operationalized. And this is quite complex and has a lot of complex detail. But what I wanted to talk about here is how open science applies to evidence synthesis. And before we do that, I wanted to talk about why open science is beneficial. And so some of the advantages of open science that have been talked about are that it allows for more rigorous peer review by being more open. It also means that research that's publicly funded is made publicly available. So that's a sort of moral obligation benefit. It's also that it allows for increased reproducibility and transparency. And we know that reproducibility is a crisis at the moment, that research is often not reproducible. And so by being open, we can support transparency and hopefully increase reproducibility. It also perhaps means that you can have a greater impact by being more open in your science. And that open collaborations, so by openly collaborating with people, you can support more complex analysis than by compartmentalizing research into smaller silos. And some of the disadvantages that I'll touch on a bit later when I talk about criticisms of open science and open synthesis are that some people feel that there's a risk that open science might make it easier to misuse data and misuse research findings. It might also mean that there's a greater chance of public misunderstanding because more information is made publicly available. And it might also mean that poor quality research is sort of easier to publish or proliferates. And that's partly a concern around preprint servers. But some of these concerns are easily dismissible. Some of them are, you can mitigate against them, but I'll talk about some of those concerns again later. And so why open synthesis? Why is open science applicable to evidence synthesis? Well, this is in part because as systematic reviewers, people who collect data from primary studies, we're already relying on the primary research that we collate to be open enough that we can extract data, we can understand the methods that people have used and critically appraise their methods and synthesize that data. So we're relying on the primary research that we pull together to be to have a certain level of openness. So evidence synthesis sort of relies on a layer of open science already. In addition to what we rely on, the methods of evidence synthesis are already building on open science principles. So in systematic reviews, it's very common and it's good practice to have an a priori protocol that outlines the planned methodology for your review, published online and time-stamped before you actually start your review. That helps you to get feedback. It helps you to publish your intent to conduct a review, and it helps to ensure that the methods that you use are going to be as robust as possible. It also helps to ensure that when you have finished your review, that you haven't shifted in what you said you would do, or you haven't chosen to report specific outcomes. You're actually doing what you said you would do from the start. So that a priori approach to science is quite important. And and that having a protocol is essentially part of open methods. We're describing the methods that we plan to use, and then at the end we have used in minute detail. That's also supported by reporting standards that are very common in evidence synthesis, like PRISMA, like ROSES. And those reporting standards also help to ensure that we're being as detailed as possible. And so the protocol and the reporting standards are essentially part of open methods, which is a part of open science. But those linkages between evidence synthesis and open science haven't been explicit. So many people who do systematic reviews wouldn't necessarily notice or be aware that the protocol and reporting standards are part of open methods. And that means that the benefits of open science perhaps haven't really been fully appreciated. Because people aren't really aware what of the methodology that is integral to a systematic review is also a key principle of open science. Another reason that open synthesis as a concept is important is that systematic reviews are often actually insufficiently open. Even systematic reviews that are published by coordinating bodies like the Campbell Collaboration, the Collaboration for Environmental Evidence, Cochrane, the Joanna Briggs Institute. They are typically more open than many other systematic reviews that are published elsewhere, and they're also incidentally more, often more rigorous. But because there isn't a framework that describes the different aspects of how evidence syntheses should be open, in relation to open science, there are often aspects of evidence syntheses once they're published that mean they're not as open as they could be, and that then causes problems with reuse of data, with verification of what people have done in systematic reviews and other things like that. And so the concept of open synthesis aims to explicitly define how open science relates to evidence synthesis. And the idea is to sort of break down the concept of open science across the methods that are used in evidence synthesis to provide a framework to support people to be more open when they do systematic reviews and other forms of evidence synthesis. And one of the also, one thing I wanted to talk about was why evidence syntheses are often closed and how they're closed. And this is one example that Chris Noon posted on Twitter, where I think it was a systematic review had said in data availability that data are available from authors on reasonable request. And someone had tried to get that data and they just replied, sorry, I can't give you my data. So perhaps that was not a reasonable request. But some of the common issues with systematic reviews in them being closed are that there might be selective or incomplete reporting of the data that is extracted in the analyses that are conducted within the review. and that's sort of an outcome reporting bias. It might also be that systematic reviews lack methodological detail, and this is one of the issues that reporting standards try to improve. It might also be that systematic reviews are paywalls. So the Campbell collaboration and the Collaboration for Environmental Evidence publish their systematic reviews open access, but Cochrane reviews are sometimes paywall, so you can't access them unless you have a subscription to the Cochrane library. Another issue that is much more common is that code used in analyses, so specifically or particularly talking about quantitative analyses like meta-analyses or meta-regressions, the code that's used to analyze data is often not reproducible, or it's not even provided. It might also be that the data that are provided alongside a systematic review are unclear. It's not really clear what columns of data mean, what rows are, what the criteria were for certain categories being applied. It might also be that the data is provided in an unusable format. It's relatively common to see data being provided in PDFs, in tables, rather than in a format that's easily digestible by machines or even by humans. It could also be that there's a waste of research because people are conducting redundant systematic reviews on the same topic. This is particularly a problem in healthcare, where there are a huge number of systematic reviews being conducted. And that research waste or lack of collaboration is particularly an issue where those systematic reviews are of low quality. And actually, if people were able to collaborate, they might be able to produce a smaller number of much higher quality systematic reviews. Another issue that is a real problem is that conflicts of interests or interests themselves are not disclosed in a systematic review, and that leads to conflicts and risk of bias. There's also a risk that not open and potentially biased systematic reviews might mislead decision makers and might affect the level of trust that's put in systematic reviews as a concept and a means of evidence provision. It also, having closed evidence syntheses, limits the capacity for updating systematic reviews. So if authors are not able to update their systematic reviews, and remember, a systematic review is only a static snapshot of the literature. If it's not a living systematic review, then as soon as the searches are conducted and finished, the review is just a snapshot looking back, and anything that's published after that date isn't integrated. So it's really important to continuously or regularly update systematic reviews. And if authors aren't able to do so themselves and their data are not open, it then means that future updates probably have to completely repeat the systematic review process. So these issues and being aware of the impact of these issues led us to establish the Open Synthesis Working Group. And it's a voluntary group of leading experts from across disciplines and sectors, from healthcare, social welfare, international development, education, environmental management. And it includes key actors from major organizations that lead the coordination and development of guidelines for methodologies around systematic review and systematic mapping, and organizations that publish methodology articles, but also publish systematic reviews. And the aims of the working group are to agree on what open synthesis might mean, so trying to provide explicit definitions of the key elements of open synthesis that I'll introduce shortly, and to do this in an open synthesis working paper, so that's what's going on at the moment, and to discuss the relative benefits of open synthesis, the costs that are associated with being open, and some of the barriers and facilitators that are associated with moving towards more open synthesis. What we want to do is to survey stakeholders for their awareness of and attitude towards open science and its application to evidence synthesis, and how ready they might be to adopt open science and open synthesis practices. We want to publish some papers to draw awareness to this issue, and also try to develop standardized file formats to make it easier for people to be open without having to conform to lots of complex, very specific instructions and guidelines around how they can make their data and their information from evidence syntheses open. One of the issues is that the data that you produce during an evidence synthesis is really extensive, huge amounts of information, and trying to be as sort of open as possible means that this can be a really costly process in trying to make that understandable, that data understandable. So by trying to produce standardized file formats that people who use systematic review software, for example, can just do automatically, would really help facilitate adoption of openness. And then we also want to try to develop a plan for research, training and advocacy of activities around the group. So it's sort of a long-term investment in trying to set out a pathway towards openness for evidence synthesis. And these are some of the organisations that are in the group. We have about 30 or 40 people actively in the group. Yeah, if you're interested in more, you can go to the website for the Open Synthesis Working Group, which I'll put up at the end. And so the draft framework that we've produced so far and that we're currently discussing outlines a number of key elements. So you remember those 6 key elements from the Vasist Open framework, Vasist Open Science framework that I introduced before, and the Foster Science Open Science framework that was more complex. We've identified a sort of intermediate level of complexity, and I'll introduce them now. So the first is a concept called open collaboration, which describes the degree to which non-selective opportunities for collaboration in evidence synthesis are available. There's open discovery, which is the move towards free-to-use bibliographic databases. So at present, we have to often pay a lot of money to access resources like Scopus and Web of Science to search for records that then go into systematic reviews. So you perform a search and then you screen the abstracts and titles. And so to access those bibliographic databases, you either need a subscription or you're very restricted in terms of what free resources are available. Or we historically have been very restricted. It also then causes problems that these databases won't let you bulk download, so you often have to break your search results down into very small bite-sized chunks and extract them. So that aspect of searching is very complicated and very time-consuming, and is problematic for people in resource-constrained contexts like low and middle-income countries. The next concept is open methods, which is a basic concept from open science. So making sure that the methodology that's used in a review is described in detail and is freely accessible alongside the results. We also have the concept of open data that's taken entirely from open science, and that's to ensure that all data produced from a systematic review are made freely accessible wherever possible, and that recognizes that, for example, individual patient meta-analyses, IDP, individual patient data meta-analyses, might be restricted in terms of their the ethics around making that data available. So there are always issues around how much data you can make available, but this is sort of on a spectrum and moving towards an ideal scenario. So there will always be contexts where some data can't be made available, but we should sort of, this is recognizing that we should perhaps move towards being as open as possible. Then the concept of open source is that any software that's used to conduct reviews should ideally be open source. The code that's used to run that software should be open to analysis, and it shouldn't be black box type software. So if there's any aspects or any methods that are being used within that software that are not understandable, not fully transparent, that could be an issue. And then we separated open code from open source. And what we mean by open code is that the analytic code that's used to conduct analyses of data should be freely accessible. So for meta-analyses, for example, this might be the R scripts that are used and can be provided alongside data so that the analyses are push-button replicable. And then open access, which is again borrowed from open science, is that manuscripts that hold descriptions of systematic reviews and other evidence syntheses should be free to access. We're also making a distinction here across all of these issues between availability and accessibility. So all of these bits of information and data should ideally be accessible freely and not just available. And the difference is that available information is relates to information that people are able to access, and that might be that you need to make a request, or you need to log in, or you need to pay, but you can avail yourself of it. Whereas what we're talking about is accessible, so it should be immediately accessible, ideally, without paywall, without any kind of barrier. So that's just worth mentioning as well. And another concept is open peer review that was part of the other frameworks as well, that peer review reports should be ideally openly available alongside the final review, so you can see what changes were made during peer review and what the comments were by peer reviewers. That's not necessarily saying that the peer reviewers' names should be available, but just the comments, perhaps. And then open education, that's training materials to support people conducting rigorous evidence syntheses, and open evidence syntheses should be freely accessible to all. And then finally, open interests, that people should be declaring their financial and non-financial interests in relation to a topic as authors of systematic reviews. So these are the concepts that we've drafted, and we're defining these specifically in terms of what we mean as an ideal endpoint, but also in terms of pathways of what might look like an intermediate step on the pathway to openness. So we recognize that in some situations it might not be possible, or even it might not be good to be as open as possible immediately or at all. And so an intermediate level of openness might be desirable. And that's what we're sort of hoping to define as a pathway to openness. And the benefits of open synthesis are that, or the potential benefits, that by being open, we can facilitate full transparency. This then allows verification of review results and conclusions. It increases the level of reliability and trust in evidence syntheses when they're clearly open. It also helps to improve resource access and participation in systematic reviews by people in resource-constrained environments like low and middle-income countries. It facilitates reuse of data. One example of reuse of data is in meta-research, so meta-epidemiology, looking at how people have conducted systematic reviews, looking at patterns in methodology of reviews and how the methods that are used in a review might affect the outcomes that are found. It also helps, or we propose that it would help increase efficiency of review conduct by sharing work. So if you have reviews that are conducted on similar topics or overlapping topics, or if you have people who want to update or expand on a review, by sharing work, by making the data publicly available, it means that people don't have to redo work, or you don't have redundant effort. There are some back of the envelope calculations that I've seen looking at in the field of healthcare, how many times a single article might be screened by people doing systematic reviews. And you end up having single articles being screened in multiple different reviews, multiple different times. And if we could just save that effort, so if someone is screening an article in a review on asthma and says, no, this isn't to do with asthma, and then goes on to do something more specifically about a particular intervention on asthma. If someone else is interested in something else also related to asthma, then they would be able to benefit from someone having read an article abstract and say, no, this isn't relevant. So that kind of increase in efficiency could be significant, could be substantial. It also then reduces the need for requests for information from corresponding authors. And from, if anybody has tried to get information from corresponding authors, sometimes it's really successful and sometimes it's not. And that often depends on how long it's been since the article was published. Often email addresses 3 or 4 years after publication might go inactive because people who have moved on and they leave their institution. And so if we don't need to reach out to corresponding authors, that saves effort. It also then reduces the risk of bias that people might deliberately not want to provide information. There might be other reasons for people not responding to requests for information. So by ensuring that all data is available, we don't need to go through that step. And it also helps to raise awareness of and improve capacity for conduct of evidence syntheses by spreading word about why rigorous systematic reviews and other forms of evidence synthesis are important and valuable. And that then also increases the impact of evidence syntheses by helping to integrate rigorous evidence synthesis into policy and practice. There are some criticisms of open science that I just wanted to discuss briefly. In that, and these are criticisms not necessarily valid, but they're criticisms that we need to think about when we're talking about open science and address whether they are in need of mitigation. And there's a criticism that the open science movement can exacerbate an imbalance of power or inequality or exclusion of minorities or marginalized groups. Often it's easier to be open if there are costs associated with being open if you're from a privileged context. So if you are from a university with a lot of funding that can cover open access fees or your time to make your data easily understandable in an open format, that causes a power imbalance. As I said before, there is a criticism that some people feel making information open means that it's available to be misused, and that will depend on the context, depend on the discipline that people are working in. There's also a risk of public misunderstanding. Some people feel if data is not curated and carefully managed in terms of how it's made public. There is a concern that by forcing people to be open, there will be an overload, an avalanche of information being published, and it will then be very hard to find relevant information within that avalanche of information, that avalanche of data. There's also a fear that if you are open and it's easier to find mistakes in data, there are fears of repercussions if those mistakes are unearthed. One consequence might be that a paper has to be retracted, and then the sort of institutional and career implications of that are potentially quite significant. And then that also relates back to power imbalance, that the people who are suffering from those kind of repercussions are likely to be people who are already marginalized or in difficult situations. There's also a concept called research parasitism that I've come across when I've been asking people for data in systematic reviews, where people have said, no, I'm not giving you my data because you're just benefiting from our work and reusing our work. And there's this concept that you are a parasite if you're doing a systematic review. I think the risk of that being an issue for open evidence synthesis, open synthesis, is much lower because I don't think systematic reviewers are going to be concerned about other people using their data as much, but there probably are some people who would rather keep their data for themselves in a systematic review for future analyses. There's also this concern that there's a proliferation of low quality science, as I mentioned before. And there are, as I said before, there are costs of being open. So it takes time and resources to archive your data in a way that is understandable and usable. And thinking about who's going to pay for these costs is important. And then there's a concept called platform capitalism that if all of this information is freely available and placed online, that certain platforms can then start charging people for access to data that's already open just by packaging it in a different format. That's not necessarily a problem if it's easy to find the information behind it that is open, but there are some people, some organizations who are in resource constrained environments who might not be able to access the original open data and might only think that they can get this data via pay for access platforms, and that then causes a sort of artificial paywall. And as I mentioned before, there are some concerns that, for example, with individual patient data, that open science is incompatible with confidentiality and ethics. So these all sort of need to be thought about and discussed. Some of them are not so much of an issue, particularly when it comes to evidence synthesis, but they some of them will need to be mitigated. And there's also that many career incentives for research scientists reward closed practices. So there's an incentive to publish in high impact journals that are typically not open access, and that we are rewarded in our careers by keeping our data to ourselves and publishing more papers in many ways. So thinking about how to change institutional reward practices that would support, in a way that would support open science, is an important consideration as well. So some of the future work of the Open Synthesis Working Group is to finalize this framework, to consider the barriers and facilitators to adopting open synthesis, what the minimum standards might be, what best practices are, what good enough practices are, to quote Charles, and think about what the pathways are to openness and what intermediate steps might look like and how long it might take to get there. And particularly thinking about what incentives we need to put in place to make it worthwhile putting effort into being open. There's also an issue around machine readability that we want to try and tackle, that just being open isn't necessarily enough if there's a lot more information being published. We need that information to be machine readable so that we can cope with the sort of avalanche of information that will come. So as I said before, thinking about different standardized file types for different steps of the review and what the outputs are, and thinking about how to ensure that the software that people use for systematic reviews supports openness. And then we also want to raise awareness and build capacity for being open. So just wanted to leave you with that schematic that we've got, and say thanks very much. If you want to know more, you can go to the Open Synthesis Working Group website, and you can read a paper that we published on open synthesis and environmental evidence.
Thanks, Neil. That was awesome. Now, do we have any questions?
I think I've got, I don't know if this is a distinct point. I think I have something else to add to your list of criticisms or your list of risks associated with open science. I think one of the biggest, this might be captured in, this might have been captured in what you said already. I'm not sure. You tell me. So I think one of the biggest risks at the moment is that we end up kind of mistaking mistaking the end goals, the end that we're trying to achieve, mistaking the means for the ends. So when we talk about things like computational reproducibility, for example, that this is a means to accountability, perhaps something like accountability or trustworthiness is our end goal, and computational reproducibility is a way to get there, or replicability is a way to get there, or pre-registration is a way to get there. These are all kind of different ways of achieving what we're trying to do. And I think what's happening more and more is that we're kind of fetishizing the means to our ends, that we're mistaking the means for ends in themselves, that reproducibility now is becoming a kind of a virtue in itself rather than a pathway to something else. And so the thing what worries me about this is that once we think that they are ends in themselves, then we lose sight of how to find other pathways to those ends when things like replicability or reproducibility aren't open to us, when they don't apply to the kind of research that we're doing. So I reckon, I don't know, I feel like one of the criticisms of open science at the moment that I would add to that list would be this sort of mistaking or not being clear about what our purpose is, what the end goal is.
That's a really good point. I'm going to add that one in. Yeah, I think there is a sort of, I like that phrase, fetishization, was it that you said, of these. I mean, when you consider the badges that have been given for open science, and when people are sort of stamped as saying yes, they're open, and then that's seen as some form of approval, when, I mean, just because the code is reproducible doesn't mean that it's good code. It doesn't mean that the analyses are good.
That kind of thing where we're at risk of ending up with a lot of highly replicable, fully reproducible, philological nonsense.
Yeah, and I think that's why it's really important to have all of these concepts acting in concert. That together they can support an improvement in rigor if they are operationalized carefully. That by having code and data available and open peer review, you have the opportunity for people to criticize and analyze the methods that have been used, and have an ongoing dialogue about whether that research is valid and to what degree it's valid, and the impact of generalizability and external validity and all of those things as a continuing discussion, rather than just yes, this is good enough. Or like, yes, they've met all of our requirements, so we can't criticize it anymore. And I think that's the real challenge, moving away from that institutionally very gargantuan institution that's built on the idea that once something's been published, it's fixed, you can't criticize it anymore, it's done, and if there's a slight problem with it, then we just have to throw it away and forget about it and retract it. And I think working on that bit in between, where like it's a work in progress, it's there are lots of different ways of analyzing the same data, people make mistakes because scientists are only human, and I think that messy, squishy part in the middle needs all of these concepts to be really carefully applied, and not just yes, you've published your data, so tick, that's fine.
Yeah,
and that's a huge challenge.
I think that's spot on. We need to be looking for the information in those messy, squishy parts. So we need to be looking for, when we get a whole bunch of different analyses of variation as a result of different analyses, we need to be looking for the information that's in that variation is telling us, or when there are disagreements about things, we need to to look at what that tells us,
Yeah.
not to disregard it as.
And I think there are moves towards that that also support this kind of concept that living systematic reviews and living evidence syntheses are ways of supporting long-term learning and improvement of what we do as a group. So the idea behind living systematic reviews is every time or on a regular basis, as new research is published, the results are integrated back into an analysis so that it's firstly as up to date as possible, but secondly, there isn't a need for waiting 2 or 3 years and then repeating the whole process. And one of the consequences of that would be that you might have someone coming along and changing the methodology a bit or applying a different method because they come at it from a different process, and you end up with these two incompatible analyses of the same system, one that was done longer ago, one that's an update, and they show different results, and you don't know whether that's because of a difference in the methodology or a difference in the mindset that someone came into. It could be a tiny tweak in the inclusion criteria. And one of the, I think, benefits of living systematic reviews is that it gives the opportunity to incrementally improve the way that we understand and analyze a topic as a collective, rather than having lots of different underpowered analyses of the same issue that just end up conflicting, and then you have to do a systematic review of systematic reviews, and then you have to do a systematic review of systematic reviews of systematic reviews. And it, I think that's where the open collaboration and many of the other key elements come together to try to sort of create a robust environment that doesn't just reward meeting these tick boxes. I think that's one of the issues with reporting standards as well, that like a lot of people think, oh, they've done Prisma, so it's fine. And it's just, I mean, so many problems with that, because you don't know the quality of the information, you don't know whether it's actually there, they just say it's there. So badges and reporting standards that aren't enforced or scrutinized just make things more cloudy. Sorry, Charles, I interrupted you.
Oh, no. It's interesting. And you just made me think that it just keeps coming up. It feels like there's a lot of space opening up for redefining how we disseminate our scientific ideas from a traditional manuscript. Like, if we have living systematic reviews, and it seems like we should have it should be completely legitimate to write a paper about an update of that living systematic review and say, well, here we've got sufficient extra evidence to warrant an update, and it's an extension of what was already published. Like with the toolchain walkthroughs and how with the rise of research software engineering, we need to sort of rethink how we integrate code and guidance with respect to code in our manuscripts, rather than just relegating them to documentation as was, conventionally done beforehand. And what do you think about different formats for manuscripts?
Yeah, I've been a long advocate for doing away with the PDF style approach, and so I'm now really trying, every time I publish a study with results rather than commentaries, which is the sort of easy way out. When I do that, I want to have a website that accompanies the article that has much more accessible and updatable versioned information that supports the manuscript. So that then gets around so many different barriers. You can mitigate an open access barrier if you have an accompanying website that has a lot of the same information, maybe all of the same information, but compartmentalized to make it easier to access the right bits of the findings for the right people or the right end users. And you can have interactive graphics that you can't in a PDF. You can have feedback. You can provide lots of different ways of looking at the same information. So even we talk about the way that different stakeholders want different forms of information, and the traditional approach to that in even best practice communication is to have, you've got the published manuscript, you then have a fact sheet, you have a summary, you do a short video brief, you do, thanks very much, Fiona, you do an infographic, and all of these things that are compartmentalized and then like just launched. So I had a colleague who used to talk about like a launch of results from a project, and it just, I had this vision of someone with a really long bazooka and just all of these like reports and just firing them at stakeholders. And I think there's lots of assumptions around what people want and how people want to digest it, what they want to read, how much control they have, how quickly they can go through information, that can be really nicely met by a website that just is interactive. It's the user has control over what they see and how they can dive in, they can select what they want to read, and I think that then becomes much more updatable. People, if they want to, you can have your R code, you can have your input data, people can then just replicate the analysis, they can see exactly what settings you've used. I think that's the future. People can comment on it. People can say, do you know what, you've made a mistake. You've used REML instead of ML, and I suggest you that. And then you can update it with versioning and transparency. And if that then causes changes in your conclusions, then you can have a clear statement about that. And it then destigmatizes this feeling that like we have to be perfect the first time round. And even when you've done a really good quality systematic review, things change. Like the context changes, the way that you might contextualize the risk of a certain intervention changes, the evidence that you have changes over time as well. And then you might also find that some of the studies in your review were retracted. And what do you do then? It's not your fault. It's data that shouldn't be in your review. Do you then retract your systematic review? And I think living analyses is the way to go. We need to move away from this time-stamped obsession with like, I've done it, look, a paper, stick it on my CV, move away. Yeah. Amen in caps.
Sorry, nice to meet you.
Nice to meet you, finally, Matt.
Yeah. Yeah, thanks for that. I had a question, just a specific one about what was it? When you're sharing, like when people are replicating effort in abstract screening, and you're talking about storing that information somewhere so it can be reused. How would that work? Would it be like a plugin in Zotero or something?
I mean, it's really interesting. We're thinking about how to do this in RAS formats by using some abandoned fields. So RAS formats have a load of standardized field codes. Many of them are like only specific to, like, for example, there's one on like chemicals described. Well, there's probably several on chemicals. And for the vast majority of research that isn't in chemistry, those field codes aren't relevant. So what you could do is you could use some of those field codes to have a relevance tag within a standardized RIS file. So that's one approach, that you just modify the RIS files and you append information on relevance. Another approach is that we have a central repository that has unique identifiers that retains all of this information. And one kind of approach that's being used in healthcare, excuse me, is Epistemonikos, which is a database of systematic reviews in healthcare. It's the largest database of systematic reviews. And they have all of their systematic reviews, and then they have all of the included studies in all of these systematic reviews. They use computational methods to identify them and extract information that are then verified by humans. But having a central repository, I think, is probably the way to go. We do that within the Mercator Research Institute. On all projects that we're working on are stored in a central database that has all of the tagging and screening information. So if an article has been screened by one of our colleagues, we know and we can extract information on that. At least I think that's the theory. but I mean, computationally, that's incredibly expensive. And when you start thinking about retaining information at full text level, then that gets even more expensive and computationally challenging to deal with. But another issue is that there was research, I'm not sure if you showed me this, one of the maths, that Web of Science has a 10% error rate with its digital object identifiers. So 10% of the DOIs in Web of Science are misused, and there are multiple records with the same DOI that are incorrect. So curating that information when it's really hard to deduplicate anyway, and then the unique identifiers that are being used to try to solve that problem have errors in. And all of this information is being curated by for-profit companies that are not publicly responsible, or not, I can't think of the phrase, but they're not answerable to the people who produce this information, the authors and the journals. I think that's a challenge as well. So yeah, I think it is a challenge, and I think it relates to computational power. But I mean, I guess the systematic reviews where this is going to be important are the ones that are within a sector. So if you're working on asthma, for example, and you've got several reviews looking at asthma, that's a fairly small body of literature that you might want to ensure that you don't have wasted effort in. So an approach like the one we're using at our organization, where we have a database of similar reviews that we are doing to save ourselves effort, is probably one approach. But then people who are working on that topic on the other side of the world can't benefit from that. So it's definitely not the answer. Good question.
Cheers.
Well, it seems like a good time to wrap it up. It's a nice round hour, right? So thanks, Neil. That was awesome. Lots in that. And yeah, excellent for me for a PhD fodder. Really appreciate it, and great discussion from the participants. Cheers.
Yeah, thanks so much for having me on, and I hope it was interesting. If anybody's got any questions or anything, just drop me a message. If anybody's interested in joining the working group, then drop me a direct message on Twitter or send me an email. Yeah, thanks so much.
Thanks.
Cheers then.